Hello, this is Diane Finisted Ellis, and I am here live only for today. And then you can watch this afterwards. I wanted to just take a minute to say thank you for choosing Humana for 2026. Thank you for being a client of mine. Thank you for being on the team. The team today, Courtney Hudson is with me, and she is the marketing assistant. Yay!
Hi.
Edith is down the hall. I'm over at the Creve Coeur office today, not in our Valley Park office today in the St. Louis, Missouri area. So I serve over 29 states, and I have all the companies in the St. Louis area for Medicare Advantage, and then all 26 companies that have a Plan G for Medicare in the St. Louis area, as well as the Part D plans. I can write Cigna, but all the other ones, guess what? The government wants you to be on your own because they don't pay any of us brokers for those plans. But I always am giving advice and advocacy, even if I am not your agent or you're considering me to be your agent or broker. So I am so excited just to talk to you about the HMO from Humana. The reason why Humana is not on the call today with us is because they have grown by leaps and bounds this year. Oh my goodness, they are the plan when it comes to an HMO, especially in the St. Louis area, if not nationwide, because their maximum out of pocket is so low. We're looking at for this year the HMO total, and which is the HMO Humana Total Complete H4461-046. That particular HMO is in the St. Louis County areas and selected counties in Missouri. That one's the most popular in this area, and that one has a $2,700 maximum out of pocket. So low, folks. Oh my goodness, in our area. So, a couple of things for you that have the Humana plan for HMO. HMO just means it is a plan where you do not have out-of-network benefits. The unique thing with Humana is if you have an HMO, you have access to their HMO nationwide. So you can go all across the country as long as they are in the HMO. So once you are looking at the plan and you're a member, here's the 800 number. It's 1-800-457-4708. Also, with the Humana plan, all of them, they have a healthy partnership. And so you can get more from this plan with extra services and resources provided by Humana. And I'm going to go over that in a little bit. But this is the book that I'm using. This is the book for this particular plan. And it says Humana HMO Humana Total Complete H4461-046-000, select counties in Missouri. So depending upon the Humana plan that you have, it could be different. So let me know if you would like to have a copy of that plan emailed to you, or you can go to Humana itself, or you can definitely text me at 314-302-5743. 302 is my birthday, and then 57 and 43. So hopefully that helps everyone to get this information. So this is the schedule of benefits. I'm going to be referencing the pages. So later, if you want to follow along, you can. So page 4 is what I'm looking at. The monthly premium is 0. There is a premium plan reduction on Part B of $2. People always ask why. The reason is at the end of the year when they did the plan, guess what? They had extra money left over. So they're going to give you back $2 on your Social Security. So look for those $2. It could be more next year in 2027. We just don't know yet. The medical deductible, there is not one for this plan. Pharmacy is 0 for tiers 1, 2, and 3. And then there is a $615 deductible on tiers 4 and 5. The maximum amount of money that you're going to spend for your Part D drug plan, D for drugs, that plan is going to, and cost is only going to total $2,100 for 2026. I'll talk about more about in a little bit. The medical maximum for medical out of pocket, your responsibility is $2,700 in network. So, and there again is no medical deductible for that. And the most you pay for copays, coinsurance, and other costs for covered medical services for this year, for 2026, is going to be $2,700. Medical benefits include when you go to the hospital for hospital inpatient coverage, you have $375 copay per day, days 1 through 7, and a zero copay per day for days 8 through 90. Diagnostic colonoscopy for outpatient hospital coverage is zero. Diagnostic mammography is zero copay. Surgery services are $300 copay. In an ambulatory surgery center, the diagnostic colonoscopy is zero. Surgery services are $200. Doctor visits are zero. Telehealth is zero for primary care. And a specialist, it's only $25. Telehealth copay is only $25. You do not need a referral to receive covered services for plan providers. Again, this is an HMO that does not require any referrals. However, I do want to say there are some times when the plan might cause for a referral from that particular provider because the provider wants to have the referral, but the plan itself is not requiring you to have a referral. So please don't get that in the crosshairs. It's just the way that it works in our healthcare system. So this plan does require prior authorization for certain items and services. My request to you is to always seek prior authorization. It gives you the peace of mind in knowing that your health care is going to be covered. So if you're laying on a gurney, you do not have to worry, is this going to be covered or not? So make sure that you do the prior authorization. The following link will take you to a list of items and services that may be subject to prior authorization. Here's the link. It is humana.com/PAL. And it's capital PAL, like pal. Like they're going to be your pal. And when they're going to go into surgery with you or into that appointment with you, and they're going to help you along. So it is humana.com/PAL, and it actually means prior authorization. So when you have preventative needs, you need to approach your doctor, your primary, and say, hey, I would like to have this done, this done, this done. Where can I find that list? It's on page 5 of your schedule of benefits. Please know that your doctor's not always going to tell you, hey, go get this preventative done, go get that preventative done. It really is up to the member to advocate for yourself and tell your doctor, get it in your record, hey, I think I might need to have a screening. I might need to have my lungs looked at, or I might need to have a diabetes checked, or I might need to have an obesity screening, or I might need to have my medical nutrition therapy support and guidance. I might need some of that, or I might need to have my annual wellness visit. But for those of you that are new to Humana, you get a welcome to Medicare visit. So make sure you tell your primary and make sure that they know that you are going there for your first time to see them. Even if this is an established doctor for you, an established primary, you're not established yet with Humana. So you need to establish, and you need to say, hey, the welcome to Medicare, I would like that to be my preventative visit. And then it actually gives you a little bit more time with the doctor. So Medicare's built that in with Humana to make that happen. Sometimes it can result in 15 more minutes. And I don't know if you're like me, sometimes 15 minutes of a conversation with the right person can change your whole day. And if it's with your doctor, might just change the trajectory of your health care for your life. So you never know. So get that extra time in when you can with the welcome to Medicare appointment. Also, emergency services at the emergency room are only $130 copay. Urgent care services are going to be $65 copay, and urgent care center is going to be a $65 copay. Now, they do say that they cover you worldwide with emergency care as well as urgent care services. If you have any urgently needed service outside the United States or its territories, you will be responsible to pay for the rendered service up front and can request reimbursement. Now, how can we get around that? I think, well, Courtney's sitting right here. She's heard this once before. She's going to hear it again. Everybody else is too, that you can get an ancillary policy, an additional policy to your Medicare, and that is going to allow you to have an extra coverage. So therefore, you wouldn't have to pay upfront if you were in a foreign country, and you might even be able to get services sooner than trying to communicate with the company here in the United States if you're in a foreign country, especially if you're in different time zones and the ways that the workday is scheduled for the United States of America as well as other countries. So my big pitch on that is if you're going to travel outside the country, that would be a text to me at 314-302-5743 and say, Diane, I'm going on this trip to this country from this date to this date. My insurance is this in the United States, and I need to know how I'm covered and what the cost would be to cover all the expenses or most of the expenses that wouldn't be covered with my with the coverage I have now. Oh, we just had somebody join us. All right. Hello. Hello.
Hello.
Hi, this is Diane Finestead. Who do I have the pleasure of speaking with?
Hi, Diane. This is Debbie.
Hi, Debbie. It's nice to talk to you. So
You too.
I'm on page 6 of the schedule of benefits for the HMO plan for Humana. So I'm going to go right into the next section, which is diagnostic services. So advanced imaging, MRI, MRA, PET scans, as CT scans. When you're in a freestanding radiological facility, it's $200 copay. Outpatient hospital is $335 copay. The primary's office is $280 copay, and the specialist office is $280 copay. The basic radiological services, like x-rays, is what I'm talking about. That one, the freestanding radiological facility is $65 copay. The outpatient hospital is $150 copay. The primary office is $0 copay for x-rays, and x-rays in a specialist office is $25, and x-rays for urgent care, that is in the urgent care facility, is going to be $65. Diagnostic mammography is $0 for freestanding radiology facility, as well as the specialist office. It's going to be $0 for diagnostic mammography. Diagnostic procedures and tests, you're looking at outpatient hospital, $35 copay. A primary care's office is going to be $0. Specialist office is going to be $25. Urgent care center is going to be $65. Lab services are going to be freestanding laboratory is going to be $0. Outpatient hospital is going to be $0. Primary care physician's office for labs is $0. Specialist office is $0, and urgent care center is $0. So just remember, if you need labs, go right where you are. It's going to be at your convenience. It's always going to be $0. Nuclear medicine and services, freestanding radiological facility is $245 copay, and the outpatient hospital is a $250 copay. And then you also have a sleep study in the member's home. This is always the lowest price. It's $0. And that's usually what they will suggest first, unless they need to have more information. And then they might suggest the outpatient hospital for $35 copay or the specialist office for a $25 copay. Therapeutic radiology, radiation therapy, the freestanding radiological facility is $50 copay, outpatient hospital is $50 copay, and then the specialist office at is a $25 copay. Again, you do not need a referral to see any of these covered services for plan providers. This plan requires prior authorization for certain items and services. Go get the prior authorization always. It gives you that peace of mind. And the following link, which is humana.com/, capital P, capital A, capital L, is going to give you a list of items that might be subject to that prior authorization. So let's go on to hearing. The main thing you need to remember with hearing is you must see a true hearing provider to use this benefit. Here's the number to call to schedule an appointment for hearing. It is 1-844-255-7144. Now, I'm going to remind you that even if you think, gosh, my ears are great, I have wonderful hearing. Well, fabulous for you. The Medicare covered hearing is a $25 copay just to go get a baseline of your hearing. My suggestion for everyone with this plan, go get your baseline, because then if something happens to your hearing, they know what it was when you were healthy. So that's why it's also important to go get all of your wellness visits and that type of thing, because you're establishing a baseline of your good health. That way, when something does happen, they can see very easily, no, this is different. This test is showing up completely different than what it's always shown in the past, and allows them to help you find answers that you're seeking at a much faster pace. So again, if you want to schedule your hearing test, or just have an appointment for mandatory, hearing, to use your mandatory hearing benefit for hearing aids, you can call True Hearing at 1-844-255-7144. So it's a zero copay in network when you have a hearing exam, up to one a year. And then it's $699 copay for the advanced level hearing, up to one hearing aid per ear per year. And then $999 copay could go up to a premium level hearing aid, up to one per ear per year. And then hearing aid purchases include unlimited follow-up with provider visits during the first year following True Hearing, the aid purchase. That is fabulous to have, because it might be different during different courses of the year. I had a client go get a fitting for a hearing aid. They didn't realize that when they went, that they were on the cusp of getting a diagnosis of pneumonia. So when they had their hearing test, it tested completely different than how it would have tested had they gone at a different time. So they started going throughout the course of the year, and the hearing aid that was originally given to them was not the hearing aid that they ended up with. So those adjustments throughout the year are very important. And then 60-day trial period on the hearing aids, a 3-year extended warranty, and then 80 batteries per aid for non-rechargeable models. And rechargeable style models, they're available for the premium and advanced aids for additional $50 per aid. That is unbelievable that it's only $50 more to have the rechargeable style, and then the premium and the advanced aids. But again, it's a matter of what fits your ear, what's comfortable, what's going to work best for you. If you need the noise canceling, if you need the directional on those hearing aids where you're looking at someone and then it takes out all the ambient noise for you, if you need to have that. So try the different ones out, because again, you have a 60-day trial period for each of those styles. So that's fantastic. And then we have the dental services. There's a mandatory supplemental dental service. Limited and exclusions may apply. So what it means is you need to stay in network with Humana. Well, how do you find your in network? How do you know what you can use and how much you have? And any amount unused at the end of the year, it's going to end at the end of this year. So you need to use your dental benefit. Now, information regarding each plan that you have for dental is going to be at humana.com/, SB. Again, they are suggesting, Humana suggests that you get a prior authorization for those services so you can know how that is going to be paid. That's important because a lot of times I will receive a call from clients and they'll say, Diane, this isn't going to cut it. I've got to have some more dental coverage. Well, if we know exactly what Humana is going to cover, well, then we can really get you some good answers for that particular concern, because we can use ancillary plans to beef up your Medicare benefits if we need to. But if we don't need to, well, my goodness, we're going to be able to see that real easily. So definitely do the prior authorization for dental prior to having it, and at the humana.com/capital PAL. So when you have scaling and when you have comprehensive oral evaluations, one every 3 years, and you look at the bridge and also crown work, as well as panoramic films and diagnostic x-rays. That could be one every 5 years, and a crown or restorative services, core buildup, also root canal retreatments. That could be one per tooth per lifetime. And then also bite chew x-rays and x-rays up to one set per year. Those are all $0. That's amazing. And so also when you look at, and that's a $0 copay is what I'm talking about. Now, if you need to find a dentist that's going to be in network for Humana, what you want to do is you want to go to humana.com/find care. And then all these things that I'm going to read to you, they're also a $0 copay. And that's adjustments for dentures, a denture rebase, a denture reline, a denture repair, emergency diagnostic exam, a tissue conditioning up to one per year, a copay for emergency treatment for pain, oral surgery, periodic oral exam, prophylaxis cleaning up to 2 per year, a copay for periodontal maintenance up to 4 per year, a copay for necessary anesthesia with covered service up to as needed with covered codes per year. And then also amalgam or composite fillings, simple or surgical extractions up to unlimited per year. Those are all $0 copays. Now, where you're going to get into the expense is 30% of the cost for bridges, that and also complete dentures and partial dentures. That's one every 5 years, and that's 30%, or 30% cost of bridges or a crown up to 2 every 5 years. And you have a $4,000 maximum benefit coverage amount per year for all diagnostic, preventative, and comprehensive benefits. That is fantastic. So you just need to find a dentist in the dental network for Humana at humana.com/find care. The F is capitalized and the C in care is capitalized. So let's go to vision. So eyewear, it is after you have cataract surgery, it's a $0 copay. Medicare covered diabetic eye exam is a $0 copay. A Medicare vision services, the provider locator for vision can also be found on humana.com/find care. And that is only a $25 copay. So mandatory supplemental vision benefit, to find that location for the mandatory supplemental vision benefit that can be found as part of Humana Medicare Insight Network. And that is your network for your Humana, is the Humana Medicare Insight Network. You can find that locator on humana.com/find care. And when you have that routine visit, one per year is $0. Again, I'm going to just put a little caveat in here. If you say, well, my eyes are fine, I'm so glad your eyes are fine. What I want you to do is go get a $0 cost exam, get a baseline on your eyes. So if something happens to your eyes, they can use that as a way to see what was normal for you and now what is abnormal. And they can usually save themselves the the actual vision specialist that you're seeing, be it an optometrist or an ophthalmologist, they can usually see what's going on with your eyes much quicker and faster because of that baseline. And they can also now, when they do little puffs in your eyes and you think, oh, they're just doing that for a little second. No, they're actually checking the health of the rest of your body, because our eyes are now indicative of what's happening throughout our body. Sometimes now, even with different services that they use and pre-screenings that they use, they can see how heart healthy we are. Amazing what they're doing now with medicine. So I encourage you to get your eye visit for $0, and that's going to be a zero copay for that routine eye exam, one per year. $75 maximum benefit amount per year for contact lenses and eyeglass lenses, or in frames and fittings, and eyeglass lenses and frames, or $150 maximum benefit coverage per year at the Plus provider for contact lenses. So Plus is spelled capital P, capital L, capital U, capital S. And that is your provider for contact lenses. If you need more coverage, that's when you call me. You say, Diane, I really want to go get a pair of sunglasses. Okay, well, let's look and see on ancillary plans, which are additional to your Medicare plan, which one is going to save you the most money. And if it doesn't save you money, I'm not going to suggest it. But if it does, I'll definitely recommend it to you. So also, eyeglass lenses may be available with the maximum benefit coverage amount up to one pair per year. Maximum benefit coverage amounts is limited to a one-time use per year. So that's why you might want to call me. You might say, Diane, I really want to have one pair of glasses. I don't want to just have one. I'd rather have two, maybe three. Maybe you use it as a way to complement your outfit. Who knows? But if that need comes up, you know who to call, 314-302-5743. So those Plus providers are part of the Humana Medicare Insight Network, and they will display the Plus provider indicator in the provider locator search results in Humana, you guessed it, .com/find care. So mental health services, the inpatient services. The plan covers up to 190 days in a lifetime for inpatient mental health services in a psychiatric hospital, 334 copay per day, days 1 through 7, and a zero copay per day, days 8 through 90. Mental health therapy services for behavioral health. I was just sharing this on another class, and I said, oh my goodness, just to pay for therapy is so expensive. Typically, a counseling one-on-one with a counselor for the under 65, it costs at least $150. So the therapy visits that we're seeing here, because you've earned this wonderful, wonderful plan, because you worked the 40 quarters to earn it and to get Medicare. What we're looking at is mental health therapy services. Outpatient hospital is only $35. A specialist office is only $30. And telehealth, where you can call and they can call you back within the hour, and that's typically how it works. They do call you back within the hour, is $30 copay. That's amazing. And then the outpatient substance abuse services, again, those prices mimic the therapy services. Outpatient hospital is going to be $35, specialist office is $30, and then the telehealth is $30. So skilled care, skilled nursing care for the skilled facility, rehab, when you go in and you're in the hospital and you need to meet those mile markers of being physically able to be at home so that you're not a fall risk, that's usually the top reason why people go into rehab. There's many other reasons too, but that's one of the top ones. If you happen to go into rehab for any reason, the plan will cover up to 100 days, but it's based on your plan of care as to whether you're going to get that 100 days. It's only $10 a day copay for days 1 through 20, and then it's $218 copay for days 21 through 100. When it comes to ambulance, an air ambulance is going to be 20% of the cost. A ground ambulance is going to be $335 copay for the date of service. And then transportation other than an ambulance is not covered. So there's no Ubers, there's no transport type of an organization that they partner with to get you from appointments and that kind of thing. That does not exist on this plan. And we're really seeing that go away as a trend throughout all the plans, even other than Humana. And then Medicare Part B drugs, we're looking at allergy shots and serum. It's only $0 for the primary care and also the specialists. And chemotherapy drugs are going to be 20% whether you're at the hospital or you're in a specialist office. So other Part B drugs, we're looking at 20%, and Part B insulin, it is limited. You won't pay more than $35 for a 1 month, 30-day supply for insulin. So that's important to know. And then also prescription drugs, again, you're not going to pay more than $2,100 altogether on all of your copays for your drugs for this year. And when you get into a tier 4 and 5 drug, you're going to be paying that deductible, that one-time deductible of $615. Now, a couple things to remember with this. If you get a very expensive drug and it's not on the formulary, we can appeal it. And so you call me, or you can call the 800 number for Humana, or you can go on to humana.com/PAL and get a prior authorization for the drug. And if it doesn't authorize, you can ask for an appeal, and you can call the customer service number on the back of your card, and you can say, how do I do this appeal? And really what they're going to tell you is they need to hear that from your doctor that this drug is medically necessary. There are no other substitutes. It is not for cosmetic reasons. It's not elective, and it's a mandatory that you have it. And then they will assign a drug level to it, a tier level, typically. So sometimes, though, when they assign that tier level, it still can be less cost to go outside of your Medicare plan and get a drug outside of Medicare. So a couple things that have helped us this year so far, even now, here it is in January, we're in the second week of January of 2026. It's helped us to look at Mark Cuban's Cost Plus drugs. It's helped us to look at GoodRx. It's helped us to look at the Canadian Med Store that happens to be located in Tampa. And then it also has helped us to look up the manufacturer's coupons and discounts, trials, and that type of thing. So if you get into a situation where you're in a drug where you need to make an appeal or you want to do a search, let me know by texting me at 314-302-5743, and I will try and advocate and help you as much as I possibly can to reduce that cost. All right, so now I am on page 12, and on page 12, it goes into these additional benefits. This is really outstanding that Humana has looked and has included some of these benefits. One of them is acupuncture. You can have acupuncture for chronic low back pain, visits up to 20 visits per year for $25 copay. And then also chiropractic services, Medicare covered chiropractic services, only a $15 copay, and podiatry services, Medicare covered, is only a $25 copay. And then when you look at medical equipment and supplies, what Humana does is it breaks it down into categories, because they're saying that the continuous glucose monitor, the CGM that people may need, the DME on that particular product, that is a $0 copay, and through the pharmacy, it's a $0 copay. And then the diabetic monitoring supplies, those diabetic supplies are at a 20% cost. And then the network, it is a retail pharmacy, is only a 10% cost. That's a huge savings. Most plans across the country, they are a 20% cost across the board for any type of diabetic monitoring that you need, no matter where you get it. But if you get it at the retail pharmacy, it's going to be 10%. And if you get it at a preferred diabetic supplier, it's 0. So durable medical equipment is going to be 20% of the cost. And then medical supplies are going to be 15% of the cost. And prosthetic devices and related supplies are going to be at 20% of the cost. Now we get into a section that I really like, which is rehabilitation services. And typically with most plans, it is one where they are looking at therapy as a chunk and they don't break it out. But Humana, we are so lucky, they do break it out. So we're looking at cardiac rehabilitation services. Outpatient hospital is going to be 30. A specialist office is 0. So if you need cardiac rehabilitation services, you're going to ask that specialist, do you offer them in your office? And if they do, it's a 0 copay. Occupational therapy, comprehensive outpatient rehab facility is $30. And the outpatient hospital is $30, and the specialist office is also $30. And then the physical therapy at all those places too, the comprehensive outpatient rehab facility, outpatient hospital, and specialist office is also $30. So then we have pulmonary rehabilitation services, and that's the outpatient hospital is $20, and the specialist office is $20. And then speech therapy, we have comprehensive outpatient rehab facilities, $30, outpatient hospitals, $30, and also specialist office is $30. And then supervised exercise therapy, SET, for peripheral artery disease, PAD, that is a 0 copay. So if you are a cardiac rehabilitation service that you need, if that is what you're needing, and you also need peripheral artery disease supervised exercise therapy, then they can break it out into therapies instead of putting it all into one. And you can actually have many more therapies available to you at the time that you need it. That's a unique thing to Humana, the way that they have built those out separately, because they really want you to get well. It's all about wellness with Humana. So a couple more benefits with this plan. Enjoy some of these extra benefits. And here's how you can get an EOC, an evidence of coverage. If you'd like to have this book, this is the schedule of benefits. If you'd like to have this book, just put it in the chat that you would like to have it, and we'll make sure that you get it. As well as if you would like to have it, you can text me and say, please send me the schedule of benefits, and you can give me your email. Again, my number is 314-302-5743. Or if you just want to go on my website and just put it in there and make a request, you can. My website is www.dianeinsuranceSTL, like St. Louis.com. So it's Diane, DIANE, insurance, INSURANCE, STL.com, Diane Insurance STL. And then you can say, Diane, yes, I want to have this book. So you can look at page 14 with me. So we're looking at how do you get even more information than the schedule of benefits? You would get the evidence of coverage. How can you get that? You would go to humana.com/plan documents, and you'd view a copy of the EOC, or you can call. Here's your number: 1-800-833-2364. And you could ask them to send you a schedule of benefits, or you could even ask them to send you an evidence of coverage. So in there, you'll see Humana has an HMO travel benefit. So Members may receive, this is so wonderful. I love this about this HMO. It's unique this year in the St. Louis area only to Humana to offer this. The HMO travel benefit, members may receive in-network benefits when services are received from a participating HMO national network provider when traveling to other states. You must select an in-network doctor within the service area listed in the booklet to act as your primary care physician. So if you want to exercise those benefits of traveling and seeing a primary outside of our main service area, where with this particular class, we're really talking to St. Louis people. So it's your area. If you want to go outside your area, please call customer service on the back of your card and talk to them about making sure that you can have those travel, because you might be a snowbird. You might spend some of your time in the South and then some of your time in the Midwest or the North. So there's also this wonderful plan called, part of the plan called Humana Well Dine Meal Program. It's a zero copayment for Humana Well Dine Meal Program. So after your inpatient stay in a hospital, in either a hospital or a nursing facility, you may be eligible to receive 2 home delivered meals per day for 7 days, up to 14 meals. So this became popular during COVID, and Humana rolled this program out. They didn't know, just like we all didn't know how our world was going to change. And Humana was the first one to call me to say, Diane, we have meals, who needs them? And all of my clients that were on Humana got the delivery of meals to them. So they do say here, meals must be requested within 30 days of discharge from your inpatient stay, and it's limited to 4 times per year. Sometimes there are other exceptions to that rule. So it's always a good thing to ask. But again, please request them within that discharge or at discharge so that you can have your 14 days of meals. The in-network provider must be used for this service. You can't choose who you want to use. You can't utilize another provider. You are responsible for all charges if you do. So you definitely want to communicate with Humana. Also, there's the over-the-counter items, and that's a mail order of $125, quarterly allowance. If you do not use it, you're gonna lose it. So you got to use it, folks. So use that $125. So the unused amount, it will actually, they say, it will roll over to the next quarter and expires at the end of the plan year. Well, you could probably do that, but I will tell you that things can change in the middle of the year. I say use it. Even though they might say in writing that it can roll over. It does, but don't count on that because things can change in the middle of a year. And sometimes this is the part of the plan that does change. So quarterly allowance amounts are available to use at the beginning of January, April, July, and October. So you'll get new installments of money each time. So the in-network provider must be used for this service, and you're going to use the Humana's plan. And it's interesting because on this one, I'm going to look at the PPO because there's a wonderful page in here, and it talks about you're going to go through Centerwell Pharmacy, and there's an order catalog book that you would use. If you want to get a printed catalog, it would be 1-855-211-8370. Again, the Centerwell Pharmacy printed catalog is 1-855-211-8370, and you can order over hundreds of over-the-counter products, including allergy medicine, antacid, aspirin, bandages, cough suppressants, sunscreen, pain relievers, over-the-counter hearing aids, multivitamins, and denture cleaners, just to name some. And you can also look at the Centerwell Pharmacy that has more information. And sometimes when you'll see January and then April, and then you'll see those increments coming and again, that are available to you, you will see new products that could be available also. So you might want to just give them a call before you order and say, have there been any new products added, that type of thing. But typically you can just use your catalog. Some of the other rewards that I love, rewards and incentives, it's called Go 365. And that is something that you will be able to sign up for on your Humana portal, which I'm going to talk about in a minute. And you can complete your eligible healthy activities like preventative screenings and exams, and you get rewarded on Go 365. You get rewarded in gift certificates. You tell them what you've done, they tell you where you can find a gift certificate. The fun thing is if you have a friend who's on Humana, you can say, hey, get the same gift certificate. And you can kind of go out to lunch together, go out to dinner together on some of the points that you've earned as rewards and incentives through Go 365. It's their wish that you will take your health seriously, and the best way to stay healthy is to just to pay attention to your wellness. It's a lot less expensive to pay attention to your wellness than try and pay attention to your non-wellness. So another thing that goes right along with that is Silver Sneakers fitness program. And that fitness program is a nationwide program. You can go on to Silver Sneakers, you can Google that. Use your search engine on your computer and you can go into Silver Sneakers. There are classes that you can do at home. There's meal plans that you can do at home. It's just a lot of fun. One of the things you're going to definitely want to sign up for is Sage Scholars through Silver Sneakers. It's about 7 times a month that you go to work out or you do a healthy activity. And succinctly, what happens is at the end of the year, if you've done those 7 times, even if you went into the to work out and you didn't work out and you just had a donut while you were there, you know, the count, you know, the points of your steps count as a visit. So if you have 7 visits every month, at the end of the year, you can convert those visits into points, and you can earn 1,000 points, which converts into $1,000 for a scholarship for either yourself or one of your family members. So I have a client right now whose son she said he's actually going to let the grandson have a foreign exchange student all of next year from Italy. So she said, Diane, I know what I'm going to do with those points as I'm working out this year. I said, what are you going to do? And she said, I'm going to go take a class on learning how to speak Italian. So, you know, you can do these classes for yourself too. That program again is part of Silver Sneakers and it's called Sage Scholars. And there's more programs available on Silver Sneakers. So to find out more, you want to find out more about your drug guide and what's on the drug list and the pharmacy directory, what you want to do is you want to go to the provider and pharmacy directory at the website humana.com/find-care. Or you can call the number for Humana on the back of your card. Also, if you want the ratings for a particular doctor for clinical quality and cost efficiency, if you're looking at certain doctors that might have been recommended to you and referred to you by your doctor, because when you're looking at the HMO, your doctor is acting as your quarterback. Your doctor is still, even though you don't need referrals, your doctor is still, the primary doctor is still the one that should probably know about who you're seeing and why you're seeing them so they can do the best job that they can for you. And so if you're asking a primary or a specialist, hey, who else should I go see? And you want to look up the clinical quality and cost efficiency, you're going to learn more about that at humana.com/care highlight. Now you can see the plan's drug guide on the Humana website. You can find that at humana.com/ Medicare drug list. So I'm going to give you those again. For the provider and pharmacy directory, it's humana.com/find-care. If you want to know the quality and efficiency of a particular doctor, you can learn more at humana.com/care highlight. And if you want the drug guide, you would go to humana.com/Medicare drug list. So, information is just a click away. If you want to have the plan documents, you can go to humana.com/plan documents. You really don't have to reach out to me. So you can go to humana.com/plan documents, or you can go to and request this information for provider directory and evidence of coverage, and also a drug guide to be mailed to you. You can go to 1-800-457-4708 to activate your My Humana account. Your online My Humana account is an as important part of your Humana membership as you are. Use it to view this plan's details anytime and access it. It's easy. You can tailor it to you. And if you already have an account, you just go to humana.com/member/manage your account and log in. And also there you can create your own login. humana.com/member/manage your account. So you don't have a login yet? Just create one using the same link in just a few minutes. And receiving information about other health insurance products. As a Humana member, we may call you to offer and other insurance-related products, and you can always opt out for those calls. It's always important to know. We don't want to be bombarded with calls we don't want, as well as anytime that you would need this particular information translated into a different language for any reason. There are 50 different languages that we can translate to, and even more than that. Again, CenterWell is your pharmacy. That's where you can order up to a 100-day supply of your medications. And again, that is humana.com/pharmacy for your drug guide, as well as where you would find through CenterWell the over-the-counter items. So, couple of things. Once that you have received your information about your Humana and your account, you can go to My Humana and you can create your account at account.humana.com. That will also give you some ways to create your account. So that kind of closes what you have in the St. Louis HMO, well, it's not really the St. Louis HMO. It's officially titled HMO Humana Total Complete H4461-046-000 in select counties in Missouri. And those counties include Audrain County, Boone, Callaway, Crawford, Franklin, Iron, Jefferson, Lincoln, also Madison, Perry, Pike, St. Charles, St. Francis, St. Louis City, Warren, and Washington. Again, this is Diane Finestead Ellis, and my numbers again, 314-302-5743. My operations assistant is Edith Voiles, and her number is 314-920-3990. And my marketing assistant is Courtney Hudson, and her number is 314-920-9816. And again, my email, or my best way to reach me is to text me at 314-302-5743, or text any of us. And you can also reach us through my website, and that's www.dianefinestead, or actually DianeInsuranceSTL.com. I look so forward to this next year. I am going to be once again going to the conference in DC in February to gain some insight and information, as well as to advocate for your care for those that are on Medicare and the ways that you receive the information about Medicare to you, and also the different benefits that you have through Medicare. And that advocacy day in DC to meet with our legislators is going to be February 23rd of 2026. I have some other conferences that I'm going to too. One of them is with the Women in Insurance Producers Unfiltered, and that group comprises of about 1,000 women nationwide. Another group is 200 women that are brokers, some men too, now that they've joined us. So we're so happy to have them. It's through Miss Medicare, and that conference is in July. The reason why I go to these conferences in February, by April, the companies have rolled out what they're going to do preliminarily in their plans for 2027, or for the next year coming up, which is 2027. By July, they've rolled out their second edition of that plan. And so we meet right after that in Miss Medicare to discuss what has happened in that release, because the companies have up to October 1st, which is the first day I can talk to all of you about Medicare plans. And then you can sign up for your next plan year between October 15th as well as December 7th, through that time. And then those plans start on January 1st. There are different ways to get plans throughout the year, depending upon your health, as well as if you've moved or if you have a special enrollment for any reason. And there are several different ways to do it. One of the things that's worth mentioning is this year, there has been an emphasis put on chronic plans. And chronic plans are one where you have a chronic disorder, and it could be from diabetes, it could be COPD, it could also be a stroke or a heart condition, and you have developed that in the year. Chronic plans are set up to have different options on there. Some of them offer a food allowance. Some of them offer counseling for different diagnoses to walk you through that journey and make it easier to access benefits and resources throughout the community. So it's one where if your health changes, please contact me and let me know. If it changes where you need to change a doctor, or you need to change your medication and you need my help with that, I'm here to help you. If you know that you might have a surgery coming up, or you need to have more dental or vision, or you're concerned about having a need for home health care, please let me know, because I am here for you. This is why I do this job. That's why I've been licensed for over 25 years. And it's why I love it, because it is a servant role. I serve you and you're my boss. So if you don't like the way that I'm working for you, oh my gosh, I got to know so I can change things and make it great. All right, as great as it possibly could be. I'm here for you. So is my team, and I'm supported by so many others too. I want to thank all those people that are in those organizations that support us, and I want to thank for you attending the Humana HMO information deep dive today. I want to thank Humana so much. All right, well, I wish you all a wonderful day. Take care. I don't know what happened. There it is. There it is. I'm like, where is it? How do I stop it?
No, it still says recording.
There it is. Okay, here we go. Bye, guys, for real. Say hi to Edith.
No, don't say hi to me.
She's like, no, don't say hi. Where is that exit?
Oh, God.
Hold on. There it is. Okay, here it is. Did I get it?
I don't know.
No, I just got to exit over there. It's so funny. I can't see it. It's right there. We just got to hit exit. Okay, bye, everybody.